Proton pump inhibitors. A common proton pump inhibitor, or PPI, is pantoprazole. It may be prescribed in various routes, including orally, with an NG tube, or as an IV injection in the hospital setting. Other PPIs include esomeprazole, ionoprozole, and omeprazole. PPIs are more powerful than antacids and H2 receptor antagonists. Omeprazole. Pantoprazole or omeprazole PPIs are used to treat damage from gastroesophageal reflux disease, or GERD, in adults and children 5 years of age and older by allowing the esophagus to heal and prevent further damage. It is also used to treat conditions where the stomach produces too much acid, such as Zollinger-Ellison syndrome in adults. PPIs may also be given in combination with antibiotics to treat H. pylori infections, a common cause of duodenal ulcers. The mechanism of action. PPIs bind to the hydrogen-potassium ATPase enzyme system of the parietal cell, also referred to as the proton pump because it pumps hydrogen ions into the stomach. PPIs inhibit the secretion of hydrochloric acid, and the anti-secretory effects last longer than 24 hours. Specific administration considerations. Packets of delayed release granules must be mixed with applesauce or apple juice and taken by mouth or given through a feeding tube. Consult the labeling of concomitantly used drugs to obtain further information about interactions, because PPIs can interfere with the liver metabolisms of other drugs. IV pantoprazole can potentially exacerbate zinc deficiency, and long-term therapy can cause hypomagnesemia. So the nurse should monitor for these deficiencies. In addition to the considerations, instruct patients to call their provider if their condition does not improve or gets worse, especially if bleeding occurs. The use of alcohol, NSAIDs, or foods that cause GI irritation should be discouraged. Mucosal protectants. Sucralfate is a mucosal protectant used to cover and protect gastrointestinal ulcers. Indication. Sucralfate is used in the treatment of ulcers. The mechanism of action. Sucralfate locally covers the ulcer site in the GI tract and protects it against further attack by acid, pepsin, and bile salts. It is minimally absorbed by the gastrointestinal tract. Specific administration considerations. Administer sucralfate on an empty stomach, 2 hours after or 1 hour before meals. Constipation may occur. Sucralfate should be cautiously used with patients with chronic renal failure or those receiving dialysis due to impaired excretion of small amounts of absorbed aluminum that can occur with sucralfate. Teaching and education. In addition to the considerations above, instruct patients to call their provider if their condition does not improve or gets worse. Anti-Flatulent Symmethicone. Symmethicone is an anti-flatulent that is commonly found in other over-the-counter antacids. It is also safe for use in infants. gas commonly occurs in the GI tract due to digestive processes and the swallowing of air. Gaseous distension can also occur post-operatively. Symmethicone. Indications. Symmethicone is used to treat the symptoms of gas, such as uncomfortable or painful pressure, fullness, and bloating. The mechanism of action. Symmethicone works by altering the elasticity of the mucus-coated gas bubbles, which cause them to break into smaller bubbles, thus reducing pain and facilitating expulsion. Symmethicone is usually taken 4 times a day after meals and at bedtime. For liquid form, shake drops before administering. Patient teaching and education. Patients can be instructed about other measures to assist with gas expulsion, such as changing position, ambulation, avoiding the use of straws, and tapering intakes of beans and cruciferous vegetables. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. Basic information related to each class of medication is outlined below. Pharmacology, gastrointestinal system, anti-ulcer medications. The stomach contains cells that secrete different substances as part of the digestive process: parietal cells, chief cells, and surface epithelial cells. Surface epithelium cells are found within the lining of the stomach and secrete mucus as a protective coating. Parietal cells and chief cells are found within the gastric glands. Parietal cells produce and secrete hydrochloric acid, or HCl, to maintain the acidity of the environment of a pH of between 1 to 4. Parietal cells also secrete a substance called intrinsic factor, which is necessary for the absorption of vitamin B12 and the small intestine. Parietal cells are the primary site of action for many drugs that treat acid-related disorders. Chief cells secrete pepsinogen that becomes pepsin, a digestive enzyme, when exposed to acid. The stomach also contains enteroendocrine cells, or ECL, or enterochromaffin-like cells located in the gastric glands that secrete substances including serotonin, histamine, and somatostatin. G cells in the stomach secrete gastrin that promotes secretions of digestive substances. Although these cells play an important role in the digestive system, acid-related diseases can occur when there is an imbalance of secretions. The most common mild to moderate hyperacid condition is gastroesophageal reflux disease, or GERD, often referred to by patients as heartburn, indigestion, or sour stomach. GERD is caused by excessive hydrochloric acid that tends to back up or reflux into the lower esophagus. Peptic ulcer disease, or PUD, occurs when gastric or duodenal ulcers are caused by the breakdown of GI mucosa by pepsin, in combination with the caustic effects of hydrochloric acid. Peptic ulcer disease is the most harmful disease related to hyperacidity because it can result in bleeding ulcers, a life-threatening condition. Stress-related mucosal damage is another common condition that can occur in hospitalized patients, leading to peptic ulcer disease. Thus, many post-operative or critically ill patients receive medication to prevent the formation of a stress ulcer, which is also called prophylaxis. Whenever hyperacidity medications are administered, there are common assessments that should be documented, such as an abdominal assessment and documentation of bowel patterns. During therapy, the nurse should continue to assess for potential medication interactions and side effects and be aware that vitamin B12 malabsorption may occur whenever stomach acidity levels are altered. Based on the category of medication, renal and liver function may require monitoring. Additionally, if a patient complains of chest pain, the nurse should perform a complete focused cardiac assessment and not assume it is GI related, because patients may erroneously attribute many cardiac conditions to heartburn. Implementation: the nurse should read the drug label information and follow the recommendations for administering hyperacidity medications with other medications or the intake of food. Cultural preferences should also be accommodated when safe and feasible, because the patient may believe in alternative methods for treating GI discomfort. A written plan of care with modifications for safe use of medications with these alternative methods may be required. Evaluation: patients should experience improvement of symptoms within the defined time period. If not, the provider should be notified. Increased pain or new symptoms of coughing, vomiting of blood should be immediately reported, because these symptoms can be signs of a life-threatening bleeding ulcer.